All right, Matt, welcome to the Biohacker Babes. Thanks for joining us
Thanks.
today.
Thank you. I'm excited to be here.
Yeah, we're excited to chat about genetic testing, lab testing, maybe even we'll get into biological age testing. So, you're doing some really, really cool work with precision medicine. So, I think just to kick us off with maybe people aren't even familiar with that term. Like, what is precision medicine and how is this different than what most people are aware of with traditional medicine, where it's kind of like a one size fits all approach? I think we're getting away from that,
Mhm.
especially with the movement of biohacking and health optimization. But what exactly is precision medicine?
Yeah, and you kind of nailed it when you said kind of the opposite of one size fits all. So another word for precision medicine would really be personalized medicine. So I probably 6 years ago, I was in traditional medicine, seeing that it wasn't really working. People weren't really getting better with this normal way that we practice. And I started seeing all this science come out around genomics and being able to actually tailor and individualize the treatments to someone down to the level of their DNA. And so that's what we do at Wild Health. So we started doing this again probably 6 years ago. And so every patient, we get very specific with what are the perfect foods for you, what's the perfect diet for you, exercise plan, what supplements will or won't work, but not just based on general recommendations if a study says this works. Because in medicine, when a study says X works, we're really saying it worked for 60% of people in the study or 70 or 80, but not for everyone. And we can get really specific if we sequence someone's DNA, look at their genetics, epigenetics, and other tests. So just much more personalized advice to get to exactly what you need instead of what most people need.
Yeah,
Yeah,
I love
I love
that.
that.
We both love
Bring up.
that. That's the future of medicine for sure. Yeah.
Yeah, I think looking at genetics has just really exploded in the market over the last couple of years, which is awesome. But in some regards, like this effort to get more personalized has actually maybe created even more confusion because
Mhm.
with genetic predispositions and SNPs, as you mentioned, we're only looking at a percentage of that study. And then it's like, did the environment actually trigger that gene to express? So layering in the lab work is something that you guys do that is so differently to see, is this actually happening for the bio individual, which I think is so important because people get so caught up in these genetic possibilities like an MTHFR. So can you explain
Mhm.
a little bit about how you layer all these things in to create a hyper personalized report?
Yeah, for sure. So you're right. A lot of people understand like the power of genetics now and then knowing your genetics, there's some benefit there. But your DNA is not your destiny. Like your genetics, there's only about 20% of your health outcome. The other 80% is how you express those genes. So DNA alone, I feel like, even though we're a genomics-based company, DNA alone is almost worthless. Like we need to know all the other information about someone, that other 80% to be able to give recommendations. And I think it's probably worth giving specific examples for people to really understand what we mean there.
Mm-hmm.
When we first started Wild Health, so my co-founder Mike Mantle and I, we sequenced our genetics at first, and as we were going through this, Mike had some difficult medical issues. He found out that his lipids were through the roof, and so he saw his physician. His physician told him to do a specific diet that works for most people, but Mike's not most people. He's Mike, and he got worse on that diet. The doctor then wanted to start him on a specific medication, a statin, which works for most people. A small percentage of people have bad side effects and it doesn't work. Well, he was in that small percentage. And as he's going through this, we looked at his genetics and we saw pretty quickly that according to his genetics, he needed to be eating pretty much the opposite diet of what this doctor had wanted him to do. And he had a very specific gene in his SNP that made him almost guaranteed to have that muscle breakdown myopathy from the statin that he got. And it was a
Mm-hmm.
very frustrating experience because if his doctor just had this information, he wouldn't have had to go through that. So there are some circumstances where just having the genetics are really helpful. But when we do want to go a step further and actually say, okay, well, what is the perfect food for you, the perfect diet for you? We need a lot more information than just genetics. So one of the first people that we saw, for example, was my mother. And my mother, I was worried about her because my grandmother had just passed away from dementia, from Alzheimer's disease. And so I was worried that she may have the genetics for that. And sure enough, she did have an ApoE4 gene when we looked at her genetics. But we got to work in optimizing her to prevent her from getting the dementia. And we looked at her blood work, not just her genetics, but her blood work as well, and collected a ton of other information and came up with a perfect plan for her. And just to give you an example, And she did great. Like in 3 months, she lost 40 pounds, reversed her insulin resistance, and told me she felt 20 years younger. So she had a really good
Wow.
success. But to get specific about what we did for food, for example, we found she had several different SNPs, like a VDR SNP, meaning she probably needs more vitamin D, a FADS2 polymorphism, meaning she probably needs more omega-3. But before just telling her to take an omega-3 supplement and a vitamin D, we wanted to look and see what were her blood levels. Was she already fixing this issue? Maybe she was already eating a lot of foods with vitamin D, a lot of shiitake mushrooms. On my property, I grow a bunch of shiitake mushrooms. Or is she already eating so much fish that this genetic issue isn't an issue for her? So it's really taking the genetics, the blood work, and then even other information like is she in Florida in the summer or Alaska in the winter when it comes to vitamin D, and bringing all that together to then tell her, okay, these are the perfect superfoods for you. These are the foods not to eat. So we really need the entire picture to be able to get that granular with people as to what to eat, how to exercise, what supplements will or won't work. We need the entire puzzle to be able to make those recommendations.
It's a
Yeah,
big
that makes so
puzzle,
much sense.
but it
Yeah.
works.
Actually, that's interesting with the vitamin D. So I have, would you say it's a variant of the VDR gene? Is that what you call it?
Mm-hmm.
Um,
That's right.
but my report did not recommend vitamin D because on my blood work, my vitamin D was like, I forget, like 80. It was like pretty high.
Mm.
Now I live in sunny Las Vegas. I don't supplement with vitamin D, maybe in the winter a little bit, but so that's interesting. You would just look at the genetics and say, yeah, you need vitamin D, but actually you don't want to have, vitamin D 200 or something like that.
Yeah.
And I also had an interesting experience with the saturated fat gene 15 years ago when bulletproof coffee was all the rage. I was doing it, yeah, fasting 16 hours a day, butter and MCT oil. I'm like, yeah, this is what I need to do. And I felt worse. And then
Mm-hmm.
someone was like, maybe you should check your genetics. And certainly I had that where it was like, oh, you actually don't want to do too much saturated fat. And that was like a game changer for me. So, such fascinating things you can learn from all of this.
Yeah. And Lauren, you mentioned the MTHFR gene. And so a lot of people have this variant, but when we see people, we don't just test that genetic variant. We also look at your blood work and when it comes to like your homocysteine level. So if your homocysteine level is good and optimal, that means you're taking care of that issue with MTHFR and when it comes to kind of getting enough B vitamins and things. So just seeing the gene is never enough. We need to take in all the other phenotypic information as well to make recommendations.
Mm,
Yeah,
that's
that
a good
one I
point.
just like feel like I'm standing on such a podium about this because I hear client after client, my root cause is MTHFR. I'm like, that's not your root cause. And it may not even actually be expressing. So I think that's so awesome
Mhm.
to actually check. Is it actually expressing in the blood work? And then we know blood work is dynamic, right? So what does that
Mhm.
trend look like over time or how you're observing things? Like how granular will you get if you see something out of range, like a little bit out of range? Are you trying to observe over a longer period of time before maybe you do like a more serious intervention? What are kind of the layers and steps here?
Yeah, it really depends on what the issue is. I mean, getting the initial, so like when a patient signs up for World Health, we send them a genetic test. That just comes in the mail. It's a saliva test. They also order the blood work. You'll get your blood drawn. And the recommendations we make, we get a lot of really very specific information from the genetics and blood work. We're able to make recommendations immediately. But as to what you're getting at, do you make recommendations immediately or over time? It's both. So we can see what trend and we give very precise recommendations because we have all this information. One of the things I tell people is it's precision medicine, it's not perfect medicine. So we
Mm-hmm.
still want to see how you react to that. So even if we see all these genetics, this blood work, all this information, you certainly should eat this or do that. We want to say what are the objective markers to measure our success, and then we'll retest in a few months and check in. How are you feeling? Which that subjective, how are you feeling, is just as important as what does the blood work show as well. We're going to take all that into account.
I
Mm,
agree, but a lot of people
yeah.
don't know how they're feeling. A lot of people really need the objective data to even
Mm-hmm.
begin to have that conversation. You ask them, like, how's your
Yeah,
energy? How's your digestion? They're like, fine, fine.
Fine.
But if you can start
yeah,
to attach to a number, then it's like, oh, maybe I do feel this. Maybe I do feel that. So I really like that you made that point of layering the subjective in.
yeah. And you're
Yeah.
right. Like a lot of people like me are just hard headed enough too that you push through kind of how you feel until you get the objective data, and then having the objective helps you reflect. Like for me, an aha moment was around exercise and genetics. So when I first looked at my genetics, I was doing Ironman racing, so I was doing a ton of volume, and And I found in my genetics a couple specific things. One, I had some ACTN and other genetic SNPs that made me need more recovery than most people. And I also had a collagen 5A1 SNP, meaning I needed more collagen protein. And at the time, I was way overtrained. I was doing what most people should do for an Ironman, that amount of volume, but I needed to do less. And when I backed off because of getting that objective feedback, I just felt so much better. In the mornings, I remember I would get up and I couldn't put my shoes on without sitting down because I was so inflamed and stiff from the overwork. And then by having that objective feedback and backing off, I started performing much better. And the collagen protein. So I used to get all these tendon and ligament injuries from the training. And when I massively increased my collagen protein intake, those went away. So I was getting some subjective feedback with the tendon and ligament injuries and with the just feeling inflamed and stiff, but I was ignoring it until I had the objective feedback. Then I was able to make those changes, see what it feels like subjectively. And now I know I can feel a little bit more about when I'm overtraining or when I'm doing something wrong.
Yeah. Just to piggyback
Yeah.
real quick, I think that giving yourself permission based on this very individualized information is so helpful because we naturally just compare ourselves to other people. Like they're training like that. I should be able to do that. And I have that too. Like I know that I need more recovery. I've learned that from my genetic profiles. And, I used to be like, why am I sore for so long? Why do I feel like I can't show up and work harder? But now I'm like, oh no, I can recover. I'm allowed to do that. The permission just is so empowering, which I love.
Yeah. And that's those SNPs specifically around recovery. It's how you frame them too. It's not like that you and I, Lauren, can't do as much. That's one way to say it. The other way to say it is our body responds more robustly to the stress of a workout. So it's always a balance between that hormetic stress, how much you stress versus the recovery. And we just know we respond a little more robustly. And so we need a little more robust recovery as well.
Very cool way to put that. Yeah.
Yeah. Yeah. And I'm the same way. I think my report said like 1 to 2 day recovery period. And same, I feel that. I feel that. Like I love doing Orange Theory Fitness, which is pretty intense for an hour. And then the next day I have to recover. I know that. And I feel better when I do. Another gene I'm really curious about. So ApoE, the ApoE gene, you mentioned your mom. Lauren and I, this is where we are very genetically similar. We have the 3 and 4. And I think some people are scared to test for this because they're like, well, if I'm at risk for Alzheimer's, dementia, I don't want to know. For us, we would rather know because we want to say, well, what can we do to prevent that? Our grandfather did pass from Alzheimer's, so there's a clear family history there. But with that gene specifically, what are you looking for on the blood work or lifestyle to help that gene not express?
Yeah. So when we tested my mother and she had this, what I said to her specifically is I said, "Hey, Mom, I've got great news for you. Not bad news, but I've got great news. We know about this thing now, and we can do something about it. If we hadn't done the test, we wouldn't have known. We couldn't have done anything about it. But having the information, we could then." So we focus very specifically on quite a few things. So any of your listeners who are interested in this and maybe have this gene or just want to prevent Alzheimer's and dementia, Dale Bredesen, a UCLA researcher, wrote a great book called The End of Alzheimer's. And in it, he kind of describes, I think it's the 36 holes in the roof, all these different things that kind of contribute to you developing this disease over time. And so we just much more intensely focused on those things. So we really focused on her inflammatory markers, optimizing those levels like the omega-3, because it's a really important thing for the brain, leaning into exercise, even more exercises, increases BDNF, which is like miracle grow for the brain. All these specific things that you would in general think about for brain optimization. We just focus more intensely on those. And she had more motivation to do the things that matter. I mean, for her, for example, I mentioned already that she had the FADS2 polymorphism, meaning she needs more omega-3. She had the VDR, more vitamin D, BCMO, more vitamin A, the collagen 5A1, needing more collagen protein. When we put all of these together, the world's perfect food for her is a sardine. So it's a whole sardine because it's got the really clean omega-3, vitamin A, vitamin D, the collagen protein with all the bones and skin. And I don't know if she would have eaten sardines if she didn't have this motivation and understand how critical this is for her. But she had wanted to be healthy her entire life, but she needed two things. She needed the precise information which we gave her and the motivation. And that testing provided both for her, and that's why she all of a sudden in 3 months was able to accomplish the thing she had been trying to do for years.
Yeah.
Yeah.
It's so motivating to have that information. And I've said this on the podcast before, like with the Alzheimer's risk, that is a big motivation for me to not eat sugar. I mean, we know sugar is bad for so many things, but I think a lot of people are like, oh, just a little bit of sugar, I'll just burn it off at the gym, whatever. But like for me, I'm like, what is it doing to my brain? Like that
Mm-hmm.
is super motivating. So I'm like, stay away from the
Yeah.
sugar.
Yeah, and things like sleep. We know sleep is important, but it all of a sudden rises to another level of importance when I say, "Mom, sleep is really critical in your brain's recovery and brain health and optimizing to prevent this." And so, just that extra motivation is sometimes really helpful for people.
Yeah.
Yeah, I couldn't agree more. Since this is such a big one for us, and I think maybe for other people that are engaged and want to prevent, what else would you say with the ApoE 3, 4 besides sleep would be highly recommended? Things like supporting glucose or reducing toxicity, whether it be through heavy metals or environmental stuff.
Yeah, so you named one. So metabolic health is critical. Metabolic health, and so optimizing for your glucose and A1C. I mean, you're going to be measuring your A1C over time. If someone who is at risk for this, I would recommend usually actually wearing a CGM for a while to really see what foods spike your glucose and which ones don't. You just tend to learn a lot by wearing that. So the metabolic health, like you mentioned, exercise. I mean, there was a study in neurology. I think it was in 2020, a big meta-analysis, and they found that physical activity and how much you exercise is a 28% lower risk of developing dementia if you're over a certain level. Exercise is probably the number one thing when you look at all the different studies for optimizing for not developing dementia. Um, the sleep, like we've already mentioned as well. People who get less than 6 hours of sleep, there was a 2021 Nature study, less than 6 hours of sleep, a 30% higher risk of dementia later. So if you are not getting adequate sleep and have an ApoE4, that's a big issue. You should definitely be focusing on sleep. Um, Diet, I mean, we talked about it in terms of metabolic health. Really, when it comes to diet, if you're really focused on kind of the metabolic health component and optimizing your hemoglobin A1C, for example, that's probably going to be the biggest thing when it comes to diet. Um, and those are the big ones. The supplements, obviously, and the toxins, like you mentioned, are important. We don't have as good of studies on those as we do exercise, metabolic health, and sleep. Those are the really big ones. But clearly, optimizing toxins, making sure you don't have a lot of mercury or other things going on, is ideal. Optimizing your omega-3 levels, like we mentioned, and vitamin D levels, those are all also important. There's a pretty big list, but I think if people focused on the sleep, exercise, and metabolic health, that's probably over 80% of it. That's where you're going to make the biggest gains.
Oh,
Yeah, for lifestyle. And
yeah.
then if we're going to check and see progress or just to see how these interventions are working, looking at lab work, are you primarily focused on, if we could just list out some things like fasting insulin, A1C,
Mhm.
inflammatory markers like vitamin D, omega check? What else would you add
Mhm.
to that? And then
Yeah.
maybe
So
sleep data.
yeah, yeah. So CRP for inflammation, as well as you mentioned a lot. So your omega-3 levels, your hemoglobin A1C, following that for metabolic health, the CRP for inflammation. You certainly could do a toxin panel as well, just to make sure there are no toxins there. And then sleep tracking. Sleep tracking is great. If you don't have a sleep tracker, don't want a sleep tracker though, I would say honestly, like and this is going to sound trite, but waking up without an alarm and feeling rested, that's just a really good subjective way to check, am I getting enough sleep? If you have to wake up every morning with an alarm and you don't feel rested, you're not getting enough sleep. So I like
Mhm.
using that with people.
Yeah. Or
Yeah,
not getting
for
enough
sure.
quality sleep. Because I know people that spend 9 hours in bed and they're so like, I feel like crap when I wake up. So something else is going on there.
That's right. And if
Yeah.
you're that in that scenario, you're spending a ton of time in bed, you're still just not feeling rested. That's when it probably is good to get a sleep tracker and see what's going on, see if there are issues with your deep sleep or REM sleep or your sleep architecture, or what is going on exactly. That's when it probably warrants further examination.
Hmm. Hmm.
Yeah. Or maybe even a sleep study. That could
Yeah.
be
Mhm.
helpful too. We could be missing a lot with the sleep issue. So,
For
on
sure.
the topic of sleep with genetics, so mine said I'm a night owl. I'm curious, what do we see with like genetic testing and sleep? Like, how true is this? Can we change our chronotype? Um, Thoughts on that?
Yeah. So I would say most of the time when we look at someone's clock genes for around their circadian rhythm, we tell them information that they already knew because they've
Right.
already kind of figured it out over time from a early to bed, early to rise, or a night owl. You can't necessarily change your chronotype per se. So I really suggest people to try to adjust your life and lifestyle to match it a little better. And while the genetics are important, I also just encourage people to experiment in how do you feel, and it's critical to not. I think a lot of people um, don't give themselves a chance to really figure out what is optimal sleep for them just because of how we've designed our world. Like it's just been in the last 100 years or so that we've had artificial lighting and things. And so we our entire all of us though, even though it's like 0.001% of human history, we've had artificial light. We've had it our entire life. So we don't know what it's like to actually live a natural life when it comes to a circadian rhythm. So if someone could take a period of time where they're using a lot less natural lighting at night, trying to see when they get sleepy, then maybe if you do have some lights, wearing blue blocking glasses at night, things like that. I think you'd be surprised because in general we're pushed quite a bit later than what is natural for us, even the night owls. It's called midnight for a reason. It should be more of the middle of the night, not when you start your sleep. So I
Very
think
good
that
point. Not enough
Yeah.
people talk about that.
Yeah.
Mid.
yeah, yeah. So I mean, historically, like we went to bed when it gets dark and gotten up when it gets light, and we're so off from that. I think most people don't realize how good they would feel if they went with a more natural circadian rhythm.
Mm-hmm.
Yeah.
Well,
Yeah.
so Renee, I'm curious. I can't remember what my chronotype was according to this report, but I don't consider you a night owl. So I'm curious what your takeaway was from that.
Yeah. Well, to be totally open, I haven't actually shared this on the podcast yet. I found out I have mild to moderate sleep apnea. So I don't consider myself a night owl because I need a lot of sleep. I go to bed like 10:30, and then I can easily sleep till like 8. So I need a lot of sleep, but this is very new. I just found this out from a sleep study. So I'm like, okay, well, I'm not getting quality sleep. So I'm needing more hours in bed than maybe I genetically should. So once I resolve the sleep
Mm.
apnea, maybe I will experience that I'm actually a night owl. Does that make sense?
Mm, yeah,
Yeah.
for sure.
So it's kind of
Yeah.
skewed right now. And that's why I mentioned the sleep study because even with the Aura Ring, I can get great sleep scores. Like I'm in the 90s all the time for my sleep scores. But if I stop breathing, for some reason, Aura
Mhm.
is actually not picking that up, but a sleep study picked that up.
Mm.
So
Yeah, yeah.
that's a whole other thing.
If you're constantly and chronically overtired, then yeah, you're going to be sleepy and you'll be able to go to bed a little sooner than what would be your natural chronotype for sure.
Right,
Mhm.
right. I mean, I guess I've never been a morning person, so I guess that kind of shows that maybe I'm meant to be a night owl. So
There you
we'll
go.
see.
Goals.
Stay tuned. Stay tuned in a couple months. We'll see how that goes. Yeah.
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 I would love to dip into the longevity section a little selfishly because that's where I had the most orange and yellow markers. So with the genetic profile, I'm looking for the greens. But
Mhm.
under so we have the ApoE 3-4, which is technically under the longevity category, and my telomeres had a lot of variations that would predispose me to decrease longevity, or I'm not sure how you would exactly word that, but I'm curious to dip into some of those and how we would then see that on a lab report expressing.
Yeah, so I don't have your exact genes in front of me, but there are some specific genes around telomere length that are associated with longer or shorter telomere length. And in general, we think having longer telomeres for a longer amount of time does lead to more longevity. But there's a lot of different longevity genes, like the FOXO gene and like multiple other ones.
Should I
So
share my screen? Would that be helpful
sure,
for
yeah,
talking points? Is
Yeah. Go
yeah,
for it.
that okay, Renee? Hang on.
Yeah.
Sending a request
I just
for
gave you
sharing.
access to share. Yeah. So if anyone's watching on YouTube or if you're listening, go to YouTube. You'll be able to see this visually. Very
Let me know if
cool.
that's big enough on the screen, just for talking points. Let me make it
You still have a
spaced
lot
out a
of
little bit
green.
more. Yeah, I get green on, well, very happy to have like
Cancer risk.
pretty much all green under cancer risk, oxidative stress. I guess they're not flushed out, but telomeres and dementia risk. I'm like, okay, I know my priorities, but we're very
Hmm.
focused on longevity here just through diet, lifestyle. So I'm always so curious, like, what else could I possibly change? So just seeing this for the first time, I would love your opinion on just what comes to you.
Yeah, I think you're right to focus on kind of the dementia risk because you're correct. You do have several that are kind of in the risk category. And the way that we do this is if you have one risk allele, it's you get a yellow, and if you have two risk alleles, then you get an orange here. So you have two risk alleles in quite a few different places. So this specifically, you kind of said how would this show up on the labs. I don't think you really would see a lot of changes on your labs per se from the genes that you have here around kind of BDNF and some of these others. So I would just look at this and be like, okay, like we know that exercise, like I mentioned, is maybe the most important thing for dementia risk. We know exercise increases BDNF. And so you have this little bit of a double whammy of having an ApoE4 gene and these risk alleles for BDNF. So I would certainly incorporate a lot of exercise, lean, even just stress with you even more. Like exercise is your best friend. Like make sure you prioritize it over other things in your life, for example.
Yeah, but then this is where it gets complicated because I need more recovery. So for me, even before knowing this intuitively, I don't want to do a hard workout every day. I actually prefer to work in a lot of mobility or just low intensity
Mhm.
exercise. This kind of confirmed how my body wants to kind of lay out the week. But it also confirms maybe why I like to exercise because I clear BDNF really quickly. So I get like these kind of burst of energy and brain clarity when I do exercise because we know that's miracle grow for the brain, the BDNF. So it's just interesting
Mhm.
how it all comes together. Like I kind of already intuitively want to do this. And then it shows me, oh, I need to do this and I need to keep doing it. But I wonder how that affects other people with BDNF because motivating people
Yeah.
to exercise is often a big jump. You know what I mean?
Yeah, for sure. Yeah. And it's about the things that increase BDNF, for example, for you. So high intensity aerobic exercise and interval training are the most effective for boosting it. So I'd say great, let's do the mobility work and everything, but having some hit training just to get that spike is important. I also
Mm-hmm.
then we would want to kind of be watching your inflammatory markers to make sure you're not overtraining. May also talk to you about, hey, maybe wearing some trackers like we mentioned. I think you mentioned the Oura Ring earlier for sleep, but some sort of tracker to also measure your HRV daily as well to make sure you're not overtraining too would be good because it is a balance. And especially for you, if you need a little more time for recovery, we also want to boost the BDNF. So then we would talk about other things with you as well. We would just kind of talk about the sleep and the metabolic health and things. And I don't see your lab specifically. Oh, actually, yeah, your hemoglobin A1C. So your hemoglobin A1C is 5. So that's definitely higher than I would like for it to be as well. So then we would potentially talk about what we can do. Maybe we should wear a CGM for a little bit to see what kind of foods are spiking your glucose that you may not even really know. Like a lot of times we'll put a CGM on someone and they'll be shocked by how much specific fruit spikes their glucose and elevates it, and they think of fruit as a health food. It can be, but for someone who has an elevated hemoglobin A1C and not the best, not perfect metabolic health, um, for those people I talk about is like fruit is really it's nature's candy. So you probably want to limit for you how much of the fruit you're having and actually see in real time what it's doing to your glucose. Because a lot of fruit that we get in the grocery store isn't like the fruit that kind of evolved over the last few thousand years in nature. It's just full of a lot more glucose and a lot less fiber and nutrients.
Mm-hmm. Oh, and
Right.
again, this is
Great
where the
point.
personalization comes in because I've worn endless CGMs, and that's what I do mostly in my coaching. And my trends for glucose are very stable, and I've optimized them. But this number hangs at 5 forever and always, no matter what I do with glucose. And I think that's just so interesting. There may be some other paths or just opportunities beyond just food. So, what else would you say may fall into that opportunity category?
Yeah, so if we were to put a CGM on you and you said, hey, it's perfectly stable and looks great, and your fasting insulin levels are good, and we may do an OGTT as well, oral glucose tolerance test.
Oh,
That's
don't make me.
because because that's really the gold standard. But I would immediately be thinking about, well, if your CGM shows really great glucose control, this A1C may be falsely elevated too. So some people just have longer red blood cell lifespan, and it leads to kind of falsely elevated hemoglobin A1C. So again, this is where the entire picture comes in. Because if you just giving me that information, the CGM plus his A1C, then I'm less worried about this hemoglobin A1C if your CGM data looks really good. Because now I just think, okay, you probably have longer red blood cell lifespan.
Hmm. And what's a good goal for A1C? What would,
Um, really, we really want to push A1C as low as we can. So under
okay.
4.5 would be really, really good. If someone is 4.4 and they really want to absolutely maximize their health span, then 4.3 is probably a little better than 4.4. Really, all the way down to kind of 4.1 or so would be kind of the lowest we ever see for there. But 5 is not bad. Like if you were to go to your regular doctor and see that, they wouldn't bat an eye at the 5. They say, okay, great, fine, we'll
Yeah.
watch this. But the lower the better when it comes to insulin sensitivity.
Mhm.
Okay.
Awesome.
Okay. Yeah. And so I'm comparing your report, Lauren, to mine, and you have a lot more orange than I do on this page, which is interesting.
Great.
Yeah, you win. You win a
Do you want to
prize.
share yours? You want to swap?
Um, that's okay. I don't want to take time to like do all that. It's okay. I'm just saying I have less orange. But something we do have the same as the FOXO3, we're both yellow, which I've been fascinated by this marker because we have longevity in our family on the female side. Our one grandmother passed at 95. Our other grandmother, how old is Mama? 96?
She'll be 96 in June.
96. And then we have a great aunt on that side that is 100.
Mm.
So our grandfathers both passed very young, though, one from Alzheimer's, one from cardiovascular disease. But do you think the FOXO3 could play a role for maybe some of the female longevity we have in our family?
Yeah, so the FOXO3 gene, it's one of the most strongly associated with human longevity when they've looked at this gene and just centenarians or people living for a really long life. So if you were to tell me what you told me about your family history and how long the women live, I would say, great, that increases the likelihood that you're going to. Then if you tell me with the FOXO3, you don't have an ideal gene there, it's like, okay, well, there's a lot of things that go into longevity. If you isolate either of those things, that you have people that live a long time, that's good. Or just isolate the FOXO3, like, well, that's not good. It's on the negative side there. But knowing them both together, I would say that um, in general, there are probably either other genetics that lead to a longer life going on in your family that maybe we're not measuring. We look at about 700,000 genes with our test, but there's a lot more than that. And there's a lot that we don't know in medicine. Or I would say, hey, probably the women in your family are doing a lot of really good things too. So like, what are the things we can learn from their lifestyle as well? I don't know if that's the case or not.
I
Well,
don't think so.
no,
No.
our great aunt who turned 100 last year, she drank daily Manhattans for most of her adult life, never exercised, and she exercised once and she didn't like it. And she pretty much eats dessert like all day long. So she's like really genetically blessed because I would not say lifestyle is supportive.
Yeah.
Wow. Yeah.
But
Wish we
maybe
Yeah.
less
married.
stress.
Yeah,
Yeah,
less
never
stress.
married, never had
Kids.
kids, which I don't have kids either, but I hear that it's quite stressful. So maybe just the minimal stress has been her thing.
Yeah, the stress makes a big difference. Yeah, I have 4 children. I can tell you it certainly has an impact, especially
Okay.
early when you're not sleeping and other things like that. So it
Yeah.
can. But stress is one of the biggest things that we don't talk about as much that clearly contributes to longevity. The biggest and best study of longevity that's really ever been done is the Harvard study on healthy aging, where they looked at a
Mm.
really lot over 1,000 people over like 80 years to see what is the one thing that makes the biggest difference. And clearly the things that we know about like smoking and drinking too much and those types of things have a negative impact. Smoking, it takes about 10 years off your life. But the one thing they found, which was even bigger than smoking, even bigger than diet, nutrition, anything else, was the strength of your social relationships, which kind of gets to this stress component. And it's that the connection that you have with others, which is a big part of, like we were mentioning, stress. So I don't know what the strength of the social relationships were for the women in your family as well, but that is a big one that people don't talk about.
Yeah. I think, well, so she didn't have her own kids, but her sister, our grandmother, had four kids, five kids, lots of grandkids. So she was always around family, but then she didn't have to, change the diapers or do any of the parenting. So maybe that's the secret there. And yeah, that's interesting because I think about the blue zones, and I know people are trying to debunk the blue zones right now, whether their ages are as accurate as they've said, but I don't think that what they're eating is that interesting because you look at some of them and they're eating like, I don't know, a lot of corn or potatoes, and you think, oh, that's a really high glucose or sugar load, but they all have purpose and social connection. Every blue zone, you can see that. Even like the
Mhm.
elderly, they are included in daily family gatherings and everything.
Yeah,
So that makes sense.
yeah.
Yeah.
Yeah, if you, I think that's my from the blue zones. That's my takeaway. You look at it, and the diets are all over the place. The
Yeah.
alcohol or not is all over the place. Like in Loma Linda, there's no alcohol, but in like Sardinia and those places, plenty of alcohol. It's all over the
Yeah.
place. But the one common, actually, the two common things they all seem to have in common is the exercise and the social relationships.
Mm.
Those two things, and all of these blue zones, there's a lot of physical activity, even to really high ages, and a lot of good social interactions and relationships. Those are the two biggest things. I think those are the two biggest things that contribute to the longevity related to blue zones.
Mm-hmm.
Yeah. Definitely can take away from
So
that.
on this same topic with aging and the Harvard study, something that you guys look at is biological age. So the years of a
Mhm.
healthy health span in contrast to our chronological age. So with true diagnostic, which I would love for you to explain what true diagnostic is, we're looking at the omic age. So the reflection of your biological age based on your lifestyle, the choices that you make every single day, because we have agency. Can you
Mhm.
explain what true diagnostic is and how we kind of test that omic age?
Yeah, for sure. So, True Diagnostic does epigenetic testing. So, I mentioned earlier your DNA accounts for 20% of your health outcome. The other 80% is epigenetics. It's what you do. And what True Diagnostic measures is actual gene expression. So, they look at about a million different genes and how you're expressing every gene, not just which genes you have. And from that, you can infer a lot of different information. So, what people are most familiar with that True Diagnostic does is the biologic age test. And if you were to get a true age test, you'll get three different scores. You get your omic M age. This is a test developed by Harvard that looks at your biologic age, and it's the best predictor of how long you're going to live. Then there's a systems age test. This was developed by Yale, and it tells your organ systems age because we age in a heterogeneous way. Different organ systems age at different ages. And a lot of times I see with people with ApoE4, their brain age may be a little elevated compared to other ages. But then the most important and the test that I really rely on as a clinician is the PACE test. So this was developed by Duke, and it's a rate of aging. And I like this one much better for a few reasons. One, it's what is going on right now. So your omic image and symphony age, it's kind of if you like had a really bad 20s, you did a lot of things you shouldn't be doing, but you're doing everything perfect now. You probably accumulated some damage, and that omic image and the symphony may be a bit off. The pace is what's going on right now, and it's been shown to be very sensitive to change. So if you have stressors in your life, like if you get pregnant, that's a physiologic stress, and your rate of aging goes up 20%, and it comes back down after you deliver the baby. Same thing if you have hip surgery, get COVID, get in a car accident, your rate of aging goes up, and then it comes back down. And you get a score from zero point 0.6 to 1.4, with like zero point 0.8 being 20% slower aging, 1.2 being 20% faster. And so because it changes with interventions or how your life's going on, we can do N of one experiments. Like if you said, I want to go get IV stem cells, or I want to completely change my diet, go from a vegan to a carnivore diet, or the other way around, or whatever. We can measure this rate of aging, do that big intervention, and then measure it again in a few months to see if it's changed. Stanford did a study, a twin study, where they randomized people back and forth between omnivore and vegan diet, and they found that rate of aging changed in just a couple of months with a big change like that. So that rate of aging test is the one that I really look at and try to dial in and stack interventions over time with people to get it as low as we possibly can.
Mm. Yeah, I like that. And the case that you said is exactly me. Like my clock was, I think I was like 37, and chronologically I'm 38. I was like, I wanted to see that lower, but my pace of aging was point 0.7. So I think
Oh,
it was,
wow.
what did I do in my 20s? My college years probably added up a little bit, but what I'm doing now seems to be working. But I still want to get it lower. It doesn't go below point 0.6 though, right? That's the lowest.
So no, technically it can go lower than that. The lowest I've ever seen is I saw someone with a 0.49 one time. So that's the lowest I've ever seen. But zero point 0.7 is amazing. That's incredible. And what that means is over if you keep this up exactly what you're doing now, over the next 10 years, you would age 7 years. So you're going to gain kind of 3 years per decade there.
Okay.
So for you over the next uh, 50, 50 years, you're only going to age 35 years there, for
Ooh,
example. So
I
that
like that.
you gain 15 years of longevity and health span.
Okay. That's good to
Yeah.
know. I'm going to keep that up. So, and that wasn't Brian Johnson, right? I think he's like point 0.6 or so. I know he talks about this a lot, but
Yeah, you.
yeah.
I don't know if he's updated his most recent one, so you could probably look and see what his most
Okay.
recent ones are. Yeah.
Okay.
Anything you can
Yeah.
share about the lifestyle and just general habits of that person that had the 0.49? I've never heard of that. It's wild.
Yeah, when they got that, they were doing some really intense stuff also around kind of calorie restriction and stuff like that. And we've the things that we've noted really make a difference is the things that we know, like optimizing sleep, stress, those types of things. But then also, I mean, we know calorie restriction is the one intervention shown in kind of all mammals to extend health span, and it certainly makes a difference with this
Yeah.
pace of aging. Again, even the pace of aging, though, even though it's a great integrator of health in general, it still needs to be taken in context of the entire person because you could certainly push it really low by with a lot of calorie restriction. But if you were to do that long term, then you're going to start to have issues with bone health and muscle health, for example, and keeping it on. So even if there's one test that's the best kind of global integrator of your health, it probably is that pace test and rate of aging. But even there's no one test that's good enough for everything. So even taking it into context is
Hmm.
important.
Yeah, that is
Right.
interesting. Like too much fasting, like anything, like any hormetic stress, there's usually a biphasic dose response.
Mm-hmm.
So, like, are we doing this forever? And for us, well, I'll just speak for myself. I'm not going to go to the extreme, not anywhere close to what Brian Johnson's doing. Like, I want to live a normal, happy, kind of fun. I'm going to push the limits, social capital kind of life.
Mm-hmm.
My pace was 0.86. And on
Mm-hmm.
True Diagnostic, my biological age was 34. So sub 6 years, which I'm like, okay,
Yeah.
That's good.
for not going to the extreme, I can deal with that. I like that. I think I want to know like how
Yeah.
to live a reasonable lifestyle, but people can kind of opt in where they want to or take it as far as
Yeah.
they want and kind of just check
Yeah,
in on this.
that's amazing. And the other thing that True Diagnostic has is not just the True Age test now, but also the True Health test. So this is measuring epigenetic biomarkers. So you can look at what is my pace of aging that we talked about, but then it'd be nice to know like what's going on exactly. So this True Health uses epigenetics to look at about to over 100 biomarkers to see what other things could be off and could be wrong. So you get a little more information about what to do about your pace of aging and biologic age, how to improve it more.
Yeah.
Yeah. Yeah. We want to know what to do with the data. The data's great, but what do we do
Mm-hmm.
about it? Yeah.
Mhm.
Yeah.
Um, Lauren, would you mind sharing your screen? I would love to circle back to one other section of the test, the macronutrient section, because
Yeah. Let me pull that up.
especially in today's world, like we have the diet war online, right? Vegan, especially the extremes, vegan, carnivore. Matt, do you think that most of this comes down to genetics? Why people are just so gung ho about this is the perfect diet because it worked for them?
Yeah, for sure. This was a big aha moment for me when Mike and I tested our genetics. It looked to me like he and I should be on exact opposite diet. So he had all these SNPs that made him sensitive to saturated fat. I didn't have any of them. I had a lot of SNPs that
Hmm.
made me more sensitive to kind of carbohydrates. So looking at it, we're like, wow, it looks like almost I need to be on almost a ketogenic diet. I can eat a lot of animal proteins and things, whereas he needed to be on almost a vegan diet. And so we tested this for ourselves, and we would eat my diet for a couple of weeks, and we were eating my diet. My lab work looked great. My inflammatory markers were down. We do the same workouts, and I would beat him at those workouts handily. I just felt so much better. And we would switch to his diet for 2 weeks, and it would reverse. My labs would look horrible. His would look good. He would start beating me at the same workouts. And we just
Yes.
realized, like,
Wow.
oh, this is why people, this is why it's like religious wars when people talk about diets, because they find the
Yeah.
right one for them and they feel so good and they get such good results that they think it's the perfect human diet. Well, not, it's the perfect diet for them. And so you're exactly
Right.
right. I think that's why everyone is so worked up about their diet is the best because it is for them.
Right.
Yeah, I try
Yeah.
to do that with
Well,
clients. They're like, which one? Just tell me which diet to follow. I'm like, I don't know. We're gonna create the Renee diet. We're gonna create the that diet because there is no one size fits all. So I think, is this the
yeah.
page that you wanted to see, Renee?
Yeah. Wow, we're pretty different, Lauren, on this one.
Oh,
Interesting.
really? I wish we could share at the same time.
Yeah. Well,
Talk me through
if
it.
you
And what do you see,
start,
Matt?
yeah, well, the
Mhm.
saturated fat, you have a lot of green in your column. I have a lot of yellow down that side.
Okay. And I know subjectively, I feel great on saturated fat. I can
Mhm.
easily follow a ketogenic diet. I don't because I try to vary my diet, but I feel good on that. And you know
Mhm.
from your bulletproof coffee days that that did not work for you. So evidence
Yeah.
supporting what we feel.
Yeah, that's exactly right. And for you, Lauren, we already saw that your hemoglobin A1C was a little higher than we like it. So keeping that into account, plus seeing this, plus seeing your ApoE4, what that tells me is a ketogenic diet really may be perfect for you because those ketones are going to be good for your brain health.
Mhm.
Having that very little to no carbohydrates is going to help your glucose tolerance and insulin sensitivity and the hemoglobin A1C, and you're going to tolerate this a lot. The other piece of the puzzle I'd want to see for you as we did a ketogenic diet is what does it do to your lipids? Like what happens to your ApoB and things, and make sure that that is okay as well. But that's one of those things that ApoB that we have really good. If it does get out of whack, we have really great medications with hardly no side effects for that. So yeah, so all of those things pointing together to you and saying ketogenic diet may be a really perfect one for
So
you.
Mm.
even with the green carb tolerance, so this is saying I
Mhm.
have good carb
Yeah.
tolerance, but the fat tolerance would kind of outweigh that considering my
Well,
A1C.
exactly. So it's the entire picture. So when I look at this, I'm like, well, okay, you with you having such low carbon tolerance and such low saturated fat intolerance, either one, like you'll be able to tolerate a Mediterranean diet or a ketogenic diet. There's multiple ones you could tolerate. But then I start thinking about the other pieces of the puzzle, like what your ApoE4 status and your hemoglobin A1C and those
Mm.
components. So that's when I start bringing the other pieces in to say, what is the perfect diet for you?
Hmm.
Yeah.
Yeah,
And then
Lauren,
experiment.
scroll down just a hair. Yeah, there you go. So there are your labs.
Mhm.
Interesting. Yeah, like your cholesterol, your lipid panel. That's so cool to tie that in.
Yeah. So
Yeah.
LDL has always sat like a hair over 100, which I'm not really that concerned about, but it always gets flagged as being just a teensy bit over.
Yeah.
And I would say, so this pie chart for anyone that's not watching, if you're just listening, it breaks down the macros of the recommended carbs to fats to proteins. It actually has me eating only 20% proteins. I feel like I eat a little bit more than that, but 40% fats, which is interesting for anyone that's like fat phobic. If you would have the same genetic profile, hopefully we would
Yeah.
not fear it so much.
Yeah. And a few things about this, like the macro breakdown, because people wanted to know this, so we put that in the report. We would get much more specific with you in general about what to eat, and we probably would increase the proteins a little bit more. This is just based on like
Hmm.
your genetics and what you could tolerate there. But for you, we probably would have those carbohydrates lower, the protein higher, the fat a little higher. Now we have LDL listed here, but we really would pay attention to more as your ApoB. So
Mm-hmm.
we would kind of scroll down to the bottom, look at like what is your actual ApoB, because that's just a better measurement than LDL in
Oh,
general.
should I have that below? I don't have anything
I think it's on a
below.
Um,
different page.
Another
yeah, it's
I
page.
on
know
a
because
different page.
I
It's the
think mine
very
was
end.
elevated. Because my recommendation was reduce saturated fat and increase fiber. Because my total
Mhm.
cholesterol is 207, my LDL is 124, my ApoB was a little bit off. I don't remember the number, but yeah, so
Yeah,
cool to tie all the pieces in together.
Mm-hmm.
yeah,
Mm-hmm.
yeah.
Yeah.
Very
Cool.
cool.
Okay. Thanks, Laura, for sharing that.
Yeah, we've
Yeah.
done lots of show and tell. I think we could probably wrap that up.
Yeah.
Go ahead, Nays.
Yeah, no, I think that's great. Yeah, if anyone wants to see what the report looks like, go to YouTube because the visuals are just great. And the whole report, it's like 43 pages. So we only showed you 2 pages, but it gives a lot of really great information. So yeah,
Yeah, and it's
really.
and for some people it can be almost too much information. So just to clarify, like this is paired with a physician and a health coach to really kind of walk you through it and talk about what's most important. Because it's a very comprehensive report, and then you're like, okay, well, what do I do? There's all these different things. So that's where the doctor and health coach comes in. It's like, what are your goals, and what did we find here? Now, what are the top 2 or 3 most important things you're going to focus on for the next 3 months? Then we'll retest and then see, are these still the most important things, or is there something else that's more important now?
Yeah, yeah,
Yeah. And so
great.
our experience, so we met with the health coach first, and I really appreciated it. It was like, let's talk about what you're already doing. So we're not just starting from scratch and kind of repeating. Let's start with your baseline. And actually, she checked in a lot with like, what do I intuitively feel I should be doing? And then layered in what she was seeing to then simplify, as you said, like 2 or 3 things. So it's not this long laundry list of things that we have to do to like turn our lifestyle upside down, which is overwhelming for people.
Yeah.
Yeah. It's kind of the Pareto's principle. What is the few things, or the 20% that's going to get you 80% of the benefit? That's kind of how we try to look at it and attack it that way.
I like
Cool.
that.
Yeah, yeah. Prioritizing. It makes it so much easier for people. So
Mhm.
awesome. Well, we love what you're doing with Wild Health and now bringing in the true diagnostic. I think there's just so many great options for people that are really looking for this personalized approach. And I'm curious, what do you see coming down the road in like the next 5 to 10 years with precision medicine? Do you think this is going to be the normal thing for
Yeah.
everyone or what?
Yeah, I think that I do, and I think the future is really AI and epigenetics. Those that's the area where, like, we've developed an app internally. It's not out there yet, where it can ingest all of this information. So the problem with this, I'll go ahead and say it, is that not everyone can afford it. It is expensive to have a precision medicine doctor and health coach and all this testing and all of that. But what we found is that large language models are incredible at synthesizing all of this data and delivering it and helping people and empowering them. We have an app that I use every day. It's got all of my information, and I can interact with it. And it knows I was at a conference in DC giving a talk, and I went into the app and said, "Hey, what should I have for lunch today?" And I'm staying at the Omni in DC, and it gave me a specific meal at a restaurant zero point 0.1 miles away, knowing my genetics, my lab work, what I'd done for a workout that morning. I'd went for a swim and lifted weights, and just incredibly precise. And then it gives me alerts, like we were talking earlier about objective feedback. It gave me an alert recently that I was overtraining. I was getting ready to get sick or injured, and I said, "Well," I just chatted back with it. Said, "How do you know that?" And it showed me the data, my HRV and my heart rate trends and everything. And I was like, yeah, I've been traveling more and I've been working out just as much, not sleeping. And I was like, sure enough, like I'm going to get sick or injured. And historically, I would have pushed through and done that. But instead, I chatted back to it and said, well, what should I do? Develop a plan for the next 2 weeks to recover, and to develop that plan, knowing what my goals were at the time too. And my only 2 goals I had was I was trying to climb this mountain called Cotopaxi in Ecuador, and I was trying to improve my pickleball game. Those were my 2 goals. So it gave me workout programs to recover and still do those things. So this app, we're hoping so that we'll be able to release this in kind of in 3 or 4 months probably, but more on the True Diagnostic side. So people who are subscribers in True Diagnostic, we're going to roll a lot of this information through that, uh, through that, and hopefully give a lot more control to people themselves, where they can interact with their data and ask it questions and ask. I mean, when it has all your data, you could ask it, "What am I at most risk for developing later in life, and what are the top 5 things I can do right now?" And it looks at your genetics, everything, and gives you information. And when I said epigenetics, what I meant by that is True Diagnostic is just getting ready to publish a study with Harvard where we found, looking at someone's epigenetics, this gene expression, we can tell not just your biologic age, but also hundreds of other biomarkers, and also predict disease in the future, and just get so much more information by looking at gene expression when we apply machine learning to it. So those 2 things, AI and epigenetics, I think is where the real future is going to be.
I'm very
Very
excited for that.
cool.
But I also want to know, am I
Yeah.
going to be out of a job? Our health coach is going to dissolve completely.
So this is a great question, Lauren. As a physician, I gave a talk in New York a few weeks ago to physicians, and I showed them the data on LLMs versus doctors when it comes to diagnosing and treatment plans, and even things like empathy and stuff. And the LLM crushes physicians every time by far. What I
Wow.
told them though is that it's not going to replace us. It's going to allow us to be humans and to do what we went to medical school to do. And the example that I gave was the someone who just called me recently with a new diagnosis of cancer. And historically, I would have turned into a data collecting, data processing, thinking about it, and then data delivering machine. I would have told them recommendations. I know now that especially tools like deep research, OpenAI, like they're just incredibly better than me plus the top 10 physicians in the world. So I don't do that anymore. Now I told them, send me everything you have, send me a write up of it, and knowing that I'm going to take that and put it in the appropriate AI engine, let it do the data processing and data delivery. And then I get to be a human. And I just asked him, I was like, well, have you talked? What is your wife saying of this? Have you all talked to the kids about it? And I could talk and given that human piece and not the data collecting and data delivery.
Mm.
So I think it changes what you and I do as a health coach and a physician, but it allows us to be more human and less machine.
That's so true because
Yeah.
we spend so much time just trying to put the pieces together. And then, yeah, you can't just have conversation, which there's always deeper layers. So appreciate that.
Yeah.
It's
Exactly.
exciting.
And people
Yeah.
are always going to need the support of how to make the changes.
Hmm.
Always. That's not going to
Yeah.
disappear.
Yeah.
Yeah. Don't worry.
Well, very
Yeah.
exciting. We love what you're doing. Thank you so much for sharing your wisdom and your time with us today. And we're going to share all the resources for Wild Health below in the show notes. But before we wrap up, we'd love to ask for one final piece of advice. Is there something that our audience can start doing today to optimize their health span, just daily joy, enjoying
Yeah.
their lifetime, anything that comes to mind?
Yeah. The nice thing is we already talked about it, but the number one thing that's going to have the biggest impact on your health span is also going to be the thing that probably has the biggest impact on your happiness today and is also completely free. And that's your relationships and focus on your relationships. Like, forget about all the biohacking stuff, all the testing, all the advanced things, all the technology, all of that. If you just focus on the strength of your social relationships, that's going to be the biggest thing that's going to not only lead to maximized health span and longevity, but also happiness today.
Hmm. Couldn't agree
Excellent.
more. Yeah. Yeah. Love
Thank you
that.
for that.
Well,
Mhm.
thanks, Matt, for spending your time with us. We're so grateful for you and all the work you're doing.
Yeah, thank you all. It was a lot of fun.
Yeah,
And
it was a lot of fun. And
yeah.
thanks to everyone who tuned in. We will see you next time.